So before to jump into today's training, just a bit of context of what i4Kids Europe is. So it's a European project that comes from the lack of European focus that is existing in pediatric innovation, and the fact that we know that the ecosystem is quite fragmented in Europe. And that's why we created this European Pediatric Innovation Network, which was needed and that is now existing since 2023. It has as goals to allow synergies between all stakeholders in Europe and reduce difference between strong and emerging innovator ecosystem. And it has a goal to really boost the innovation competitiveness of pediatric sector in Europe. So that being said, we had some successful outcomes lately. So we had last month in Riga, the Pediatric Innovation Day 2024, which was really a successful event to get everyone together and have a full day focus on pediatric innovation. And we have this pediatric innovation training capsule that are going on. We are coming to an end. So if you want to see the one that you might have missed, you have them all available in YouTube, and I will send you the link afterward. So that being said, we just talked about Riga and Latvia, and today we have our Latvian expert, so a patient experience expert, Vita Steina, who has a broad experience from children's hospital to government, and she will talk about the global best practices in pediatric patient experience and the key consideration to enhance the care for children and parents. So Vita, the floor is yours.
Oh, to have access to share, sorry.
Yes.
Right. I hope you see everything works, and I just got message from my friend that she is not able to join us. I hope somebody will let her in. Eva from Latvia.
I will send her a mail. Perfect.
Thank you so much. Okay, dear healthcare colleagues, I really love seeing your names because some of you I already know, and we have collaborated together. This is like a bit of homecoming back for me, because I used to work in a Children's University Hospital in Riga in Latvia for almost 7 years. And what I've been doing at the moment, I work in two largest adult hospitals in Riga, in Latvia, and do the same. I try to improve the human experience, which I'm going to talk a bit more today. Also, I teach at the medical university and collaborate with the health ministry and WHO. And we have one great project ahead of us, and that is to redesign Latvia's healthcare quality strategy. And what's new about that, or innovative, is that patient experience will be as equally important component as the patient safety and the clinical effectiveness. I will divide my presentation in two parts. I'll show you and explain a bit of concept of human experience and also share what really matters to patients globally. And the second part will be already best practices that will help us to understand how to improve patient experience. So let me introduce the concept of the human experience that is defined by the Beryl Institute, and it encompasses three main target audiences that are really important, equally important if we want to really improve the experience. So patients and their loved ones, the healthcare workforce, and the communities. And the communities, it is like a bridge to healthier society, but very important or crucial to remember that workforce experience is the first step. Because workforce experience has significant impact on patient experience, and only motivated, engaged, appreciated employees, they really can provide empathetic, supportive care, educate patients, and respect their values and preferences. Let's move on. What is important to patients in the world? Are patient expectations the same even among European countries? And do you know what matters to patients in your country or even in the clinics? So the Beryl Institute did a great research, and it was a global study. And just today, actually yesterday evening, they launched the latest study about the year 2004. So what does it show? The data shows that for patients in Australia, Canada, United States, the most important is that staff listens to you. If we see United Kingdom, the most important in United Kingdom for patient is that staff communicates clearly in a way that you can understand. And if we see the Philippines, the most important part for patient is that environment is clean and comfortable. And here is the same research just done in Brazil. And you can see for Brazilian people or patients, the most important part is that staff provide confidence in their abilities. And if you see the bottom 5, so waiting time, convenient parking, room amenities, all about the infrastructure is less important to patients. So what can we say? That despite the growing role of technologies in healthcare, the human interactions are still most important if we talk about the people encounters. And well, time will tell us whether the artificial intelligence solutions will compensate the lack of human interactions in future, because we know we have a workforce shortages and also the burnouts. That this could be a great actually discussion for future. In Latvia, we currently have 3 national programs for inpatients, obstetrics, and mental. And now we are working at the moment for outpatient questionnaire that will be launched next year. And our goal is to give a chance for patients to respond about or give the feedback about their experiences during the healthcare encounters, at least for 60% of all the patients. Some of the most popular PREMS questions or questionnaires, I think the most popular ones in a global perspective is HCAHPS and Picker Institute. HCAHP more focus on communication, attitude, discharge information. Picker Institute focus the same, but also about infrastructure, comfort level, etc. In Latvia, we have a mixture of both questionnaires, and these are categories that we measure: support, respect, safety, discharge, comfort, communication, shared decisions, and medications. And what's good about this is that each ward, each clinic, they can see their own results. And this is one result of general results of the hospital. And how far you are from the green color, it means that you still have to do some improvements to reach the goal that you have set. We see that respect is quite good, 84. If I would compare it to American hospitals, they have usually 19 and more. So we still have, but this is the set that the goal that we set to ourselves. It was 70% at least top box results. So you can see how it goes. But what we did on the Global Council of the Beryl Institute, where I collaborate as well, we decided we have to find out what are top of all the questions that really matters to patients globally, because not all hospitals are open to have long questionnaires. They want to use like 1 or 2 or even 3 questions at all. And these are our results. All the world, all the members from the Global Council, we conducted this research in our countries. And as you can see, there are more or less 6 questions that are common in all the world. And these questions are always related to the human interactions. These are relational questions. So if you do not have any question and would like to do that, to implement, join I think it was on this week, webinar. It is a recorded webinar in the Beryl Institute webpage. You can find that one and find more information about this measure. Before I dive into pediatric best practices, I want to highlight an important project we implemented in a collaboration with Sant'Anna School in Pisa, hospitals in Riga, Helsinki, Florence, and Sofia, Rotterdam, and the UNICEF organization, and that is Voices project. And the aim was to strengthen children's rights during the hospitalization. And here are the topics of the questions we ask to our patients. And the 2-year project resulted in the questionnaire designed for children and adolescents of all ages. Now, if we move on to what is important to improve and how to improve, I'd like to share this concept, and that is an experience framework. These are all 8 categories that really have impact on experience results. But some of these categories have the most significant impact. And if we can use the chat, if Charlotte can help me, I'd like to ask you, can you write in the chat, what do you think, which of these categories have the biggest impact on patient experience results? I will just wait for your answers. So I don't see any answers yet. Or you're shy, or there are some technical problems?
I think I'm receiving directly to me. So I see one about environment, another about staff and provider engagement.
Okay, what else do we have?
Environment and hospitality.
Okay, and now I lost my slides. Do you see my slides?
Yes, we do. And I have 2 other answers: staff and provider engagement, environment, patient, family, and community engagement.
Perfect, thank you. So I will reveal the correct answers just in 1 second or 3 seconds. 3, 2, 1. I hope you see that, because I lost you, but I can see my slides at least. So if you can see, then staff engagement has the most impact. It's 93% of the impact. Then followed by culture and leadership, and patient and family community engagement, and quality and clinical excellence follows. There is a really interesting thing about the environment and hospitality. It has increased significantly, percentage of it. It has increased actually during the COVID time. So environment and hospitality, I think we have some maybe not so good experiences so far, and during the pandemic, and that's why we understand that it really matters, this hospitality and also safe environment. What was interesting also, what I found out during the Voices project, is that from the interviews with the patients and their parents, that nurses are more important for children and doctors are more important for parents. And if we see that many activities, many improvement activities are actually meant for doctors, but I think we have to think or implement more improvement activities to the related to compassion, compassionate support, and train nurses for that. I think that would be a great combination, and we would succeed even faster than just working on communication with the doctors. So now let's start some practical solutions implemented by hospitals, not only in Latvia, but also from different countries. Emergency room. In my experience visiting hospitals over I would say 7, 8 years quite actively. Emergency departments are the ones that usually are forgotten a bit. More patient experience improvement activities are focused on wards and clinics and outpatient clinics, but very important is to address the accessibility of the information for patients while they are waiting in emergency room. So these are 3 examples. I know in Riga, Children's University Hospital, they also have the screens that inform patients about the possible waiting time during related to the triage color. So last year, no, actually this year, I was in a hospital de Cascais, Portugal, and you can see their screens as well are designed to introduce the waiting times according to the colors. What I really loved, Children's Hospital Los Angeles, USA, they launched this activity this year in Elevate conference that happened in USA, organized by the Beryl Institute. And the app sends notifications in real time to patients or their parents while they are waiting in emergency room about their progress, including activities behind the scene, what happens while we are waiting. Usually we think that nothing is happening, but actually there are people working on our from the labs, etc. And what is great about this, that this app even allows two-way communication, and patients are able to inform if they're in pain, if they're cold, thirsty, all the options that you can see on the screen at the moment. In Latvia, Children's University Hospital in Riga, we were inspired by examples from the America, USA, and introduced freelance support staff in emergency room unit as well. And they assist with information and help children to engage in activities when appropriate. What's good about the adult hospital in Riga East University, they also implemented freelance staff to help in navigation. But what's good about it, they took out them from the help desk and located in exact spots where usually patients feel confused. And so they go to places where their help is needed most. And of course, navigation, you can do it by metro lines or whatever solutions you can find, but definitely the future is digital solutions, either apps or any other tablet provided solutions that helps you to navigate not only outside of the territory, but also inside the hospitals to go to the exact room where you need to go. A standout example, I know in Great Ormond Street, they have child life specialists. So we have in Children's University Hospital as well. And I think it works really good, not only for patients, but also both for parents as well, by explaining what to expect during procedures or surgeries or MRI examinations and etc. So in Riga, there is one enthusiastic nurse in the oncology, Madara. So this was her idea to create a therapy bears that help children to understand what will happen with their body during the treatment, during the chemo. So the bears can lose their hair. We can take off the hair they have at the moment. They have boards in their chest, and they become like constant support toy during the whole hospitalization, like best friends, where children can reflect what's happening to them on the toy. This idea I borrowed from Joe DiMaggio Hospital that is in Florida, Orlando. So what's good about this hospital, they received the golden standard status for in-person centered care from the organization Planetree. And patients think that they are driving the car to the surgery room or procedure room, but actually nurse is having the remote control and doing that part for children. So they focus on driving, on having fun, not feeling so scared about where they are going and what will happen to them. If I could suggest at least one activity, then this would be this. Bravery box is the most effective from all the activities I have seen so far, and I have worked with and implemented in Children's Hospital. So each patient receives a gift, very small one. They can choose from the bravery box after visiting procedure room or after having some examinations. And they really want to have this gift, and they collaborate with nurses, and it takes less time. They do not cry so much anymore. So it is a really great idea. You can definitely borrow. Playrooms. During the pandemic, everyone remembers, we have had some quite restrictions. Playrooms were closed, and hospital teachers in Latvia delivered packages, small packages with coloring pages and reading materials to children's rooms, so they can spend some time and educate themselves or play, entertain themselves, and do not feel so lonely. This activity is really good one. This is educational material in ICU unit, which was created together with the staff from the ICU. And it is meant to reduce stress and anxiety, especially to parents of the patient. These are booklets with drawings and not photos on purpose. It would, if we would include photos from real life, it would become more scary. So drawings makes it less scary. And it explains what exactly each equipment means. And sometimes, also from my personal life as well, when I didn't work in a children's hospital, my youngest son was in ICU. I was scared from each and everything what I saw there. I thought it is like I don't know, NASA, some kind of, or any other company, because I couldn't understand why so many equipment is needed. And this kind of information would help me a lot if I had it 10 years before. Virtual reality goggles are really already used and effective tool already for many years. And this example comes from Spain. They use VR goggles with a special program to reduce chronic pain. So it really succeeded. Patients report having less pain by 30% at least. I know that these kind of activities were done also in Latvia, in Riga, but I cannot go deeper in this because I do not have much information, but I know it was also used in ICU. So maybe colleagues from Riga can expand on this when I finish my presentation. So whiteboards are really widely used in hospitals to keep patients informed about their care, about their teams, daily procedures, dietary information, how do I feel today. But I have to say that with the development of the technologies, I've seen more now electronic version of whiteboards, and I believe these are not so effective anymore. And recently in Latvia, actually this summer, we had a new law. We had changes in patient rights law, where it was one extra point was included that medical staff has to introduce themselves to patients and their family members. And this sticker reminds to staff, please knock before you enter the doors, the room, and introduce with yourself. So these and the sticker with the hand reminds staff and asks whether your hands are clean before you enter the patient room. This was a funny story because person-centered care invites workforce to communicate, especially with children, on the same eye level. So we try to avoid the power position, standing and looking to children from up above. So when I introduced this idea in Riga hospital, one doctor told me, but Vita, we don't have anywhere to sit in a room by the patient. So what we did, we bought a really simple folding chairs from IKEA and put in all the rooms so they can have a conversation and encounter with the patients on the same eye level. Well, design, I hope you all who were participated in Riga conference saw the new hospital, and those who are building the new hospital, I know Copenhagen is building, and there are a lot of in Barcelona and other cities in Europe, there are new children's hospitals either already launched or working on. Yes, I think that walls and infrastructure can heal, and that is for sure. So we try to create environments so children feel less fear, are engaging and discovering all kinds of objects and images and tasks in the hospital. So basically, hospital walls communicates with patients, and procedure room now is called room of strength. So words also have power. Remember time when we had visors at the very beginning of the COVID. So this is one approach how to make lemonade out of lemons. And one more approach or activity during the hospitalization is that do not stop, celebrate holidays, festivals, anniversaries, birthdays, because being at hospital is very scary. And I'd like to share that Mayo Clinic, that is one of the top clinics at the moment in the world globally, they did a research, I think it happened last year, and they found out that the emotion that is most felt from patient's side at Mayo Clinic is fear. So they decided not only focus on their excellence in clinical side, but also how to reduce fear to the patients. So this is exactly parties, positive emotions is the way how to reduce fear from children as well, because being at hospital and being sick is part of life, of course, but it does not stop us from being human beings who has life going on. So we are not just patients, but personalities with values, with preferences, with needs, and these kind of events is form of support as well. And for me, most important, of course, is all about the communication, because words, attitude, compassion, it is the most effective way to improve patient experience. And what here are mentioned like 5 really popular communication methods that we also used in Riga to train the staff. And heart, head, heart, it is for improving empathy. Blast is to express compassion more. IDET is a regular daily day communication method. Heart is when the adverse event has already happened and you need to apologize. So this is a great also method to use. And the escalation tips, I have to say that this is the method that is most demanded now from the staff. If I actually gave to the staff in both adult hospitals at least 10 methods to choose, and they told me that de-escalation is something they needed already yesterday. But if we talk about the aggressive patients, then I think it's important to address that there are at least 3 steps that needs to be trained together. First is the spike method or any other method that helps you to structure the bad news, how you announce the bad news to the patient and their loved ones. Then there is a de-escalation tips, the steps you take. And then when person really gets aggressive, then there is code violet or purple. That is in America. I'm not sure if we have such codes at all in Europe, actually. So if person is attacking, so each and everyone know in a hospital how to react on that and how to help colleagues to get out of that situation. Educating, informing, engaging patients in their care is crucial step to gain better health outcomes. And I guess everyone has heard about Cleveland Clinic as well. And they did this pilot research a few years ago, including 2,500 patients, colonoscopy patients, by sending them videos and reading materials in plain text, explaining how to prepare properly before procedure, as they had 25% waste visits due to patients who were not prepared well enough. So not only they reduced those waste visits, but also they used less sedation. Also, the procedure become shorter, and they could have some extra patients during the day. So, and it is just by creating explanation materials so they can understand how to prepare properly. So one of my favorite examples about how to reduce rehospitalizations is by recording the discharge information and send it to patients after discharge. In this case, the Coleman Regional Medical Center, they recorded and sent the link to patient. And after discharge, they see if patient clicks too many times on that link, the patient receives phone call from the hospital and they ask if everything is clear. So they reduced rehospitalizations by 7%. I was just recently in Middle East in the patient experience conference and met representatives from Saudi Arabia. And they told me that they have implemented a new follow-up program. They discharge patients, and in 30 days, patient receives phone call from hospital 4 times, so once per week. And they prescribe medication if needed. They advise to go to the family doctor or local polyclinic to receive some extra support if needed. And they reduced rehospitalizations by 98%. Imagine that. This is the discharge form that was designed by patients themselves. So they wanted to, all the information you see, all the wording, the choice of words, everything was done by patients themselves. So if you really want to raise the adherence level, this is the way to go. And I think this kind of, I would say, plain text and easy understandable discharge form would be really beneficial for adolescents as well. For quality, food quality and catering services are very important. Everyone likes, most people likes to eat. And nowadays we have so many choices. And if we talk about the children, then children are the most picky customers. So unless it's very famous fast food chain or the round object we love to eat from Italy, so they will look carefully before they eat. So Children's University Hospital in Latvia did a really amazing job. They had a 3-year plan how to improve the catering and food quality. They transformed basically everything, starting from new kitchen staff, a chef. You can see Jakobs, the guy on the back is the chef of the Children's University Hospital kitchen. They had a new menu that do not repeat in 2 weeks. So children were involved and gave their feedback about the food quality, the colors, the taste, And a really interesting fact that children like products in a meal that they can recognize, and they are not mixed together as like 2 boiled vegetables in the soup. Yes, and what else? Jacobs, the chef, he likes to surprise children during their birthdays as well. And kids even made drawings that are integrated into the plate design. So the aim of this is that if kid wants to see what is at the very bottom of the plate, he has to eat all the products that are in all the meal that is in the plate. As I mentioned before, workforce well-being is #1 or the most important step if we truly want to improve patient experience. So I remember that when I worked in Riga, I asked one of the doctors, what is the way how you want that patient thank you actually? And she told me, just say thank you, nothing else. So we created all kind of design of the thank you cards, put those on nurse stations that are available to patients as well. They take cards and write appreciating words to the staff they take care of. Also, you can use badges. For example, if you have measurements, how to measure actually the indicators, how to measure the outcomes of the patient experience, you can celebrate the good results with the champion teams. As you can see in a photo below, this was one of the teams who got the best results from the patients, and they got the badge that says caring for people caring for human in 2020. What was like interesting, we gave award to all the teams, champion teams. Each team received award in 1,000 euros. They could spend it as they wish. So one team had a team building event. They went with a boat to some of the cities in Latvia. The other team bought a coffee machine, quite sophisticated one. And third, I think they bought couch for nurses. What else? At the moment in Riga, in Children's Hospital, very popular are massage chairs. And I know in American hospitals, they have quite a lot of those as well. So staff likes like 15 minutes relaxed time for short moments before you go on again. And also nature, plants, it's extremely important to have those in staff rooms as well. There is one activity that is launched by the Plane Tree organization, and it is called Lavender Code. And it means that from your staff, there are a couple people who are trained to support you in bad days or situations when you really feel low. So they will come to you, they are prepared, they know how to help you, like immediately. For example, if patient died or you had an extremely tough conversation with the parents of the patient. So you know you will have 15 minutes support from the staff. So it is called Lavender Code. And before I finish, I would like to introduce you with the concept coming from Institute for Healthcare Improvement. And if you have no idea how to improve workforce experience, you can use this concept. And that is their white paper or framework for improving joy in work. So it consists of 9 really significant criteria, steps you can work on and think what's important for your workforce in your clinic, in your hospital, in your exact team, are related to all the parts you see at the moment. So this is all from me. If you have any questions, please let me know.
Thank you so much, Vita. I think it was really interesting with all the best practices and initiatives you show at global level. I encourage you to open your camera and your microphone to ask directly question to Vita. If there is no question, I have one from my side. So you mentioned at the beginning that one of the most important part is like the communication with the patient, right? And I was wondering, which role do you think the artificial intelligence can have in this way? Because we know that sometimes technology can also hinder communication with the teams, but it can. How do you think it can be used as an asset in with children's?
Yeah, well, last week I was in Portugal, whole 5 days working with I think there were 15 European countries, representatives from the healthcare sector, regarding the healthcare quality. And the focus was, a big focus was on patient experience. And we discussed about artificial intelligence options, possibilities in future, what to do, what to create so they can help with the communication actually. And what we found out that the worst position in many hospitals where we measure, where we have PREMS, is psycho-emotional support. We lack staff for that. We do not have included psycho-emotional as part of procedures. So we tried, actually, it was a funny exercise. You can try that as well. You just open, ChatGPT or whenever another artificial intelligence tools and ask or tell you have a sad day. If you have had a bad day, you need some psycho-emotional support and see what happens. And the text coming out were amazing. I would say I understand that we need a professional support, etc. But I see there is potential that, for example, in patient portals or in tablets that are available in hospitals, where is all the information related to the patient, education materials, etc. There could be some part where artificial intelligence take part as well in trying to support patients by communicating with them.
Great, really interesting. It's true that I guess there is a lot to do on that.
I'd like to just, if you have some time, I'd like to also say that all of this takes a lot of time. And do not expect to have results in 1 year. It will never happen. For me, in Children's Hospital, it took 3 years to feel the first result, first successful feedback from the staff, even 3 years. Now I am in a position in 2 adult hospitals where everyone hates me. I'm the intruder in their lives. I'm at the very beginning stage at the moment. When I come and show their results, what patient comment on their work, on their processes, I show them improvement areas. They don't like that. People don't like when we want to change something, especially the culture. So it is very hard work. It's not easy to do, but it takes time, and you need a one owner of the process to really improve. It will not be so successful if you will divide this responsibility to all the staff. You need one driver to that, one conductor to that.
Thank you. I don't know if there is another question.
Sorry. One last comment is that in Europe, we really live in silos. We really do not cooperate. And I don't know much about the European experience, because either I don't know languages, how to find those experiences, but all of those that we collaborate during the WHO projects or any other projects, I know they don't have patient experience at all. So this is something that we need to focus in European level.
Is there another question for Vita?
I think I may ask something. We were wondering if there's any special project for the urgency when the patient has the first contact in the hospital, like not the whole experience during the kids are there.
Can you repeat the question one more time, please?
Yeah, sorry, about the urgency experience, like when they have the first contact in the ambulance or something like that, you know, at the beginning of the process. Do we have any project that is working on that?
I have some emergency activities for in emergency room, for example. But if you mean urgency, like that is like acute care, then I'm not sure. I cannot remember at the moment that. But I think those that happen in emergency rooms, those are relevant for acute care as well. And most of that are related if children are at a younger age with the options to play through the toys, through the support of images that are on stickers, big stickers, for example. So they are busy to observe interesting objects on the walls, on the doors, etc. Even sounds helps. If it's possible also to implement some sounds. But for adolescents, this is the group that we forgot usually. We do not work a lot to improve adolescents' experience. So we need to think about that more.
Thank you. Any other last question?
I don't have a question, but just a comment, as we are like community of innovations, and today we heard not maybe high level like technical innovations, but those are like kind of many innovative solutions, but they also face the same problems, changes. Also all innovations and that kind of innovations, what is maybe not so pricey, but it's also from the first impression, it kind of feels simple, but as it like affects changes that people don't like, then that yeah, that is a common thing for like technical innovations and innovative solutions, that everything takes time. And also even that is something simple, but what matters a lot for the patient, we also need to be ready that we will face some issues regarding some resistance from people working in the hospital.
And yeah, and just to add the comment to you as well, one thing is to implement something, but the other thing is to sustain and maintain that. And there, I know there are some activities that have actually died in children's hospital because there is no ownership of that, and nobody maybe reminds the patient perspective so much as we maybe it's needed. So stuff is lazy, you know. We are all of us are lazy.
Thank you for your comments. So if there is no other question, well, thank you a lot. I think it was really insightful. I really like also the link that you have done with patient experience and the staff well-being and its involvement. I think it's also really interesting to take into account. So yeah, thank you so much for this impactful presentation. I will share your information to those who want to get in touch with you, because you present so many interesting projects. And yes, this session is recorded, so you can share with some people that might be interested in learning about that. And let's Yeah, let's get together in November for another training capsule. Thank you, Vita, and thank you all the participants today.
Thank you. Bye.
Bye.